patients with gout frequently develop heart disease. And so it's been known since gout was first described, really, that people with gout frequently are overweight. They frequently have insulin resistance and metabolic syndrome, or conditions associated with the development of diabetes. They not uncommonly have some kidney disease, and they frequently have an increased risk for high blood pressure and heart disease. So it was noted in the 1950s that patients with gout frequently develop heart disease. And then a big question came: could the gout be contributing to the heart disease, or is the gout the consequence of the heart disease? For the last 40 years, people have thought that gout was the consequence of heart disease, and gout was the consequence of being overweight. But there's more and more evidence that uric acid may have a role in causing high blood pressure and heart disease. And if that's the case, then trying to do things to reduce your uric acid level could theoretically be a benefit to reducing your risk for heart disease, kidney disease, and so forth. There are increasing evidence that the uric acid may have a role in heart disease, and that lowering uric acid may be a benefit. Our group in particular has studied this. In animals, if you raise uric acid, you can develop kidney disease, you can get high blood pressure, you can show that it has a role in fatty liver and insulin resistance, and you can block the development of diabetes in animals by lowering uric acid. But this does not mean that we're ready to actually recommend lowering uric acid for cardiovascular health, because we need to do bigger trials and to understand it better. There's certain foods that are well known to increase the risk for gout, and trying to reduce those foods might be of quite a lot of benefit, not only for reducing the risk for gout, but also for reducing obesity and reducing cardiovascular complications. Our group in particular has studied sugar, and sugar and high fructose corn syrup are both sweeteners that contain fructose, and fructose raises uric acid. And it looks like fructose also induces fatty liver, it induces insulin resistance, it increases visceral fat, it increases the risk for high blood pressure, it increases the risk for kidney disease. So reducing sugars, like soft drinks and so forth, could be of great benefit for both weight as well as for the risk of gout.